Do you know what diabetes is? Do you know what causes it and what this disease does to your body? Do you know how to prevent developing diabetes or how many people suffer from it in America? If you don't, or if you want to learn more about diabetes, continue watching this video. My name is Ross. I'm a nursing student at SCPI University, and today I'm going to be talking about diabetes. Diabetes is considered a chronic disease that affects how your body is able to transform food into energy, according to the Centers for Disease Control and Prevention. This energy is very important for the cells that are in your tissues and muscles, and especially for your brain. Diabetes appears when your body doesn't produce enough insulin or cannot use the insulin as it should. In the United States, there are more than 122 million people living with diabetes. There are three different types of diabetes. Diabetes type 1, it often appears during childhood or adolescence. Gestational diabetes, this is when you are in pregnancy. Diabetes type 2, it can be at any age, but is more common in people older than 40. The signs and symptoms of diabetes can be fatigue, irritability, frequent urination, extreme hunger, increased thirst, unexplained weight loss, presence of ketones in the urine, slow healing sores, blurred visions, and frequent infections. The risk factors for the development of diabetes depends of the type of diabetes. For example, for the diabetes type 1 are not very clear, but it can be family history, such as having brother, sister, parent with type 1 diabetes, and age, because there is a higher probability to you to develop the disease when you are a child or a teen. For diabetes type 2, it can be overweight if you are 45 years old or older, family history of a parent, brother, or sister with type 2 diabetes, physical activity less than 3 times a week, and history of gestational diabetes or having a baby who weighed more than 9 pounds. The risk factors for gestational diabetes can be if you had gestational diabetes previously, if you had given birth to a baby with a weight more than 9 pounds, if you are overweight, older than 25 years old, family history of type 2 diabetes, and if you have any hormone disorder. Some of the measures from the prevention and management of diabetes can be if you eat a healthy diet. Everybody is different, therefore, there is not a single magic diet for people with diabetes. But people can have a guide that can help them to start with the different diets. That is the diabetic plate method, where there is a healthy balance of protein, vegetables, and carbs. Here you can see the diabetes plate method. In the management of diabetes, it is very important to have control of the amount and type of carbs that you eat, because these carbs are broken down in your body into glucose, and then your pancreas needs to release insulin to help the cell in the absorption of the glucose. There are three principal types of carbs in the food, which are sugar, starches, and fiber. Therefore, it's important to select carbs that are rich in fiber, minerals, vitamins, low in added sugar and sodium, and unhealthy fats. When selecting the carbs, you need to eat more non-starchy vegetables like lettuce, broccoli, cucumbers, green beans, and tomatoes. Eat some of the minimally processed carbs like apple, blueberries, strawberries, brown rice, sweet potatoes, and black beans. Also, you need to eat less refined carbs like juice, sweet tea, white rice, cookies, cake, and chips. Another measure for the prevention and management of diabetes are to practice exercise. An important part of the diabetes management is regular physical activity. You can start taking regular walks or running. It is fundamental to set goals and meet them. When practicing exercise, take into account that your blood sugar may decrease until the point of hypoglycemia, depending on the level of activity. Therefore, you can check your blood sugar to see how the exercise is affecting you and learn how the different types of physical activity may influence your body. Another measure for the prevention and management of diabetes is the medication treatment. It depends on your type of diabetes, blood sugar levels, and complications. Therefore, you need to consult your doctor to have the adequate treatment and follow up. Some of the medications are insulin. There are different types of insulin such as rapid acting, intermediate, and long acting insulin. Insulin can be used for the type 1, type 2, and gestational diabetes. According to your needs, the doctor can adjust the treatment. Therefore, it is very important to check your blood sugar levels daily, especially when using insulin. Oral medications, they are usually used for type 2 diabetes. Some of these medications are metformin and glucotrol. In the treatment of diabetes, besides keeping checking your blood sugar levels daily, we also need to perform the A1C test. This blood test doesn't require fasting and shows the average blood sugar level for the last 2 to 3 months. The target level in diabetic patients is an A1C below 7. Now let's talk about the complications. Diabetes can produce long-term complications, especially if the blood sugar levels are not well controlled. Some of the complications are cardiovascular disease, such as coronary artery disease, heart attack, stroke, and atherosclerosis. Nerve damage, neuropathy. It can damage the circulation to the nerves, which can produce tingling, numbness, burning, or pain, especially in the legs. Kidney damage, nephropathy. Diabetes can produce kidney failure or end stage of kidney disease, which may require a kidney transplant or dialysis. Additionally, it can produce eye damage, retinopathy. It can lead to blindness, cataracts, and glaucoma. Also, foot damage can produce foot infections, which may lead to toe, foot, or leg amputation. Skin conditions, bacterial and fungal infections, hearing impairment, Alzheimer's disease, and depression. Now let's talk about the complications of gestational diabetes. Gestational diabetes can affect the baby and also the mother. Some of the complications for the baby are excess growth, hypoglycemia, type 2 diabetes later in life, death before or shortly after birth. And some of the complications for the mother are preeclampsia, gestational diabetes in the next pregnancy, and diabetes type 2 later in life. In conclusions, diabetes is a chronic disease that affects millions of people, and others don't even know that they have it. Some of the risk factors for the development of the disease are having family history of diabetes, being overweight, leading a sedentary lifestyle, and maintaining an unhealthy diet. Some of the measures for the prevention and management of diabetes are eating a healthy diet, practice regularly exercise, and following the right medical treatments. Complications can be developed from poor management of diabetes, such as cardiovascular disease, neuropathy, nephropathy, foot damage, retinopathy, and infections. These are the references that were used for the development of this video. Thank you for your attention.